it was actually clinically not viable. It would take 45 minutes to scan someone. Now you can imagine trying to sit.
45 minutes?
Yeah,
Wow.
you'd have to sit perfectly still for 45 minutes.
Good morning, Professor Barker. Thank you for joining us today. To begin, could you briefly introduce yourself?
I'm a professor of radiology and bioengineering at the University of Colorado, Anschutz.
You have spent many years conducting various research at the CU Anschutz Medical Campus, one of the world's leading academic medical centers. So in your opinion, what is the greatest strength that makes CU Anschutz stand out?
The University of Colorado Anschutz is a consolidated campus of multidisciplinary research, expertise, and clinical practice. And so there's a strong connection between our research and our clinical practice. But also, quite honestly, it's this idea of patient-centered innovation. We aren't in a lab in the basement half of a mile away. We are right there in the hospital seeing the problems that our clinicians have. And I believe personally that this has led to our reputation on the international scale.
So recently, K-MEDI Hub and CU Anschutz Medical Campus have successfully reduced scan time, cardiovascular blood flow analysis through your collaborative research. Can you explain this research in a way that people without a medical background can easily understand?
Sure, I'll try. Although I have to say, sometimes I find that even when I try to explain some of the concepts that we're working on, can become quite complex. The technique that we're working with this collaborative project is something called Flow MRI. So imagine that you put your thumb over a water hose, and now all of a sudden it's hard for the water to flow, but it's also squirting out, and that causes the heart to work too hard. And that can be quite consequential if it's doing that over the course of your lifetime. And that's really the main purpose behind this project, was to image fast, improve our patient comfort, maintain the diagnostic accuracy.
The core technology behind this research, 4D Flow MRI, has been used in clinical practice for some time. So what were the limitations of the conventional approach, and how did your research overcome these challenges?
Traditionally, when I started out almost 20 years in this research area, if we wanted to do this 4D flow exam, it was actually clinically not viable. It would take 45 minutes to scan someone. Now you can imagine trying to sit
45 minutes?
Yeah, you'd have to sit perfectly still for 45 minutes. I won't go into the details there, except to say that we're collecting less data, getting better images, and faster. We're getting down into, I started at 45 minutes, we're getting down to 3.5 minutes. And so this is really quite impactful for those patients, not just the elderly, but also our children who can't sit still for a long period of time.
That's amazing. Artificial intelligence, so-called AI, is rapidly transforming the field of medical imaging. How do you see AI shaping the future of radiology and disease diagnosis over the next 5 to 10 years?
It's interesting. It's a question that I don't think we know the answer to, but it's very exciting. I think we're already seeing its impacts in areas where the interpretation takes a lot of manual work and a lot of review of images. And I like to think about today where we're at with AI is the equivalent of a supervised intern or resident. You may be able to ease your workload, but you have to watch the work and you have to keep an eye on the output.
Yeah, so you believe that AI won't replace us, it just helps us?
I do not know if the singularity will happen. I certainly have a hard time believing it at this period in time.
So having collaborated with research institutions around the world, what do you see as K-MEDI Hub's unique strength as a global research partners?
And I think in our world, we have to have strong translational capabilities. You need to have that strong, close collaboration, both between institutions, but also among the individuals involved in those research endeavors. And I think that's where, with K-MEDI Hub, we certainly have experienced a high degree of professionalism and motivation to solve mutual problems. One opportunity that we see in the future is not just in the digital twins, but potentially medical device development. And I think K-MEDI Hub has that research infrastructure that offers the opportunity.
In addition, what advice would you give to Korean researcher and medical technology companies on how they can make the most of this partnership as they prepare to enter the US market?
Well, I think these personal relationships are paramount. So my advice would be really to branch out, go to the international conferences, meet the people doing the research that is relevant to the areas that you work in, learn their problems, see how you can have and solve mutual problems, because you really have to be working towards similar goals. I would rather have a student and a collaborator that communicates better than someone who is very technically proficient but cannot communicate their ideas.
What qualities of Dr. Ho made such a trusted research partner?
He's very productive. He's a hard worker, but also a good communicator, and that's always extremely important because at the end of the day, that's our job as scientists, is to communicate our ideas to the world to hopefully solve the big problems.
Okay, so we're gonna wrapping this interview up, and Professor Barker, thank you for sharing your valuable insight with us today. We look forward to seeing many more achievements in the years ahead.
Thank you.
So much.
It's a pleasure to be here, and thank you for inviting me to be here.